I would like to now invite Emmanuel, who is ready with the speech and very enthusiastic person, and he's a professor in hematology at African University, and is an prolific researcher known for groundbreaking work in hematology, immunology, and public health. And he has authored hundreds of peer-reviewed scientific publications, and his research has earned international recognition and areas like HIV, the transmission, infectious diseases, and anemia. So I take this opportunity to invite Emmanuel. Emmanuel, it's the stage is yours. You can take the call now, please.
Okay. Good day, good morning, good afternoon, the participants, the organizers. He has already introduced me. I am Professor Emmanuel Obeagu, and I'm working here teaching hematology in African University in Zimbabwe. Please, can you share my my slides?
Yeah, definitely. We are going to do that. Yes, you can go ahead. Now it's there.
Yeah, so it's my pleasure to be part of speakers of this well-organized conference.
Great,
so I appreciate all the previous speakers. I appreciate all the effort the organizers have made. And today I will be presenting bridging gaps in sickle cell disease care, technology-driven solution. In fact, I have so much interest for the scholars, for the researchers, for some donor agencies that are in the house. I have so much interest whenever it comes to sickle cell disease. Sickle cell disease is a great burden to developing countries, low resource income countries, countries where malaria is endemic, particularly sub-Saharan Africa, that have been suffering from malaria because of that genetic the advantage that is conferred on the body, hemoglobin S. Because of that, sickle cell anemia or sickle cell children will always persist within that region or endemic region, because it confers selective advantage, protective advantage for immunity, for protection, for life as a defense. And because of that, there will always be some people who have that sickle cell traits, which maybe if there is no proper genetic counseling, may result to the production having sickle cell children. And it comes with a lot of problems. It comes with a lot of pains. It comes with a lot of crises. It comes with a lot of economic burden, both on the parents, on the society, and everyone is involved. So please, the next slide. I hope you can hear me. I hope you are hearing me. I hope everyone is hearing me. Hello.
Yeah, this is your next slide. Abstract.
Yeah, sickle cell disease remains a major global health burden, particularly in low resource settings where access to specialized care is limited. So traditional diagnostic and treatment approaches often fail to reach undeserved populations, leading to poor disease management and then high mortality rates. Recent advancements in technology, including artificial intelligence, telemedicine, and digital health interventions, are transforming sickle cell disease care by improving early diagnosis, patient monitoring, and personalized treatment. So the emergence of gene therapy, particularly CRISPR-based genome editing and length viral vector-mediated gene correction, offers a potential curative approach for sickle cell disease. However, the high cost, ethical concerns, and accessibility barriers pose significant challenges to its widespread adoption. The next. Next slide. Okay, good. So sickle cell, of course, all of us know that is a hereditary hemoglobin disorder, which is a single point mutation in a globin point 6, whereby there is a replacement of valine, glutamic acid by valine. And of course, some of you that are in nutrition will understand that better. Because of that single point mutation, it brings about the sickling of the cell, when particularly in the case of a low oxygen tension, and of course polymerization that of course with a hallmark of inflammation, which triggers vaso-occlusive crisis, and then resulting to pains both on the joints, both on the chest, and then of course reduce oxygen perfusion, and of course this will come with a cardiovascular issue. So it's a hereditary hemoglobin disorder that affects millions of people worldwide, with the highest prevalence in sub-Saharan Africa, the Middle East, India, and parts of Caribbean. And it is characterized by the production of abnormal hemoglobin S, which causes red blood cell to assume a sickle shape, leading to vaso-occlusive crisis, leading to chronic anemia and organ damage. And because of the anemic incidence, so many of them always visit hospital. So many of them are hospitalized, admitted, and of course they are among the patients that we know that they are constantly transfused, and blood transfusion, we keep on saying, is to be for a last resort. So despite advancement in medical landscape or science, sickle cell disease remains a major public health concern. And that is why it's always attracting the concern of donor agencies for research, for projects, because those people are people, they are passing through pains, and these researchers are getting worried to get cure. Of course, even though we have bone marrow transplant as a curative approach, but of course, it is only effective at a tender age, and it is costly. And of course, gene therapy, particularly gene editing therapy, is another way, but of course it's costly, especially in low resource setting. So concern due to its associated complications and the limited availability of specialized care in many regions. So addressing these challenges require innovation in technology, technological solutions that improve diagnosis, treatment, and then disease management. The next. So one of the key barriers of effective sickle cell disease management is delayed diagnosis. Of course, in health setting, if you're able to get accurate, definitive diagnosis of any disease condition, of course, you are in the almost near to improving the life of a patient. But whereby there is a delay in the diagnosis of sickle cell disease, of course, you will notice some of them having a very big stomach, belly protruding as if they are pregnant, and that is as a result of manifestation of hepatosplenomegaly because of much oxidation, much stress in them, particularly in low resource setting where newborn screening programs are either absent or undeveloped. Early diagnosis is crucial in reducing mortality and preventing complications. Yet traditional diagnostic methods such as hemoglobin electrophoresis and genetic testing are often inaccessible to many affected populations. Like the last speaker who dealt with the community health aspect, who visited a lot of places setting in rural areas, in low resource settings, to compare what happened there and then what happened in their own places. You will notice that most of those health centers, primary health centers, they don't even perform electrophoretic analysis to know the genotype, the hemoglobin electrophoretic pattern, the genotype of the children, even at early stage. And of course, before it is known, it's because they are always sick. They are always sick, and they are visiting hospital. Some of them discover that this child is a sickle cell child accidentally, not because they know that truly this child is a sickle cell child. And then, of course, if you give them proper care, proper treatment, proper management early enough, when you see them on the way, on the road, in the schools, you may notice you don't even know that they are sickle cell children. Looking at some physical examination, looking at some clinical presentation, you will not even easily notice. They live their normal life, they live long, they marry, they give birth. But of course, if you fail to diagnose it early and the level of fetal hemoglobin is not high to confer protection on them, they're in fact inducing production of making having a stronger affinity for oxygen, Of course, they will be having a constant incessant crisis, and that will be leading them to hospital. And both the parents, the society, the doctors, the clinicians, everybody in the hospital, everyone know that is a problem. And of course, my first degree project I researched was on sickle cell children. And of course, one of them that I collected sample from was asking me why among all the children in the house, she's the only one that is a sickle cell child. Why must it be she? And I told her, you cannot question God. You cannot challenge your mother. You cannot challenge your father. Why they gave birth to you? You are a child. You came into the world. Who are you to challenge the parents? But of course, I talk to the parents that are here listening to me. Of course, you people have children. You're also a parent. You have some of you are lecturers. Some of you are teachers. Some of you are working in different places. Please create awareness for this sickle cell screening. Create awareness, especially those that are in the rural areas. Before you know it, the teenage pregnancies, they keep on producing sickle cell children, and these children will be asking, why do you give birth? Why do you bring me to suffer in the world? You have not intentionally brought them to suffer, but of course you should know your genotype early enough, and this is a preventable occurrence. It is better to prevent it than handling it at a curative level. So telemedicine has emerged as a powerful solution to bridge the gap, allowing patients to consult specialists remotely and receive a continuous care through digital health platforms. Mobile health applications and wearable devices now enable a real-time tracking of pain crisis, oxygen saturation level, and medication intake, helping both patients and healthcare providers to make informed decision early enough. Artificial intelligence and big data analytics have also contributed significantly to personalized care for sickle cell treatment strategies. So AI-driven models can predict the likelihood of a vaso-occlusive crisis, which we know is central to the problems, even to the untimely death of a lot of sickle cell patient children, by analyzing the patient data, including genetic markers, environmental factors, and previous pain episode. And let me offer this advice to the listeners. I know you don't have a sickle cell child, but you may know where they are. You may know the clinic, their clinic days. You may have a relative that is one of them. Please, you need those children. You don't need them to be so far from you, because some of them, a lot of environmental factors can trigger the vaso-occlusive crisis by initiating, activating the inflammation in them, and some cytokines are activated will now make the whole thing become excruciating, and sometimes it also leads to maybe a thrombosis, and of course sometimes you hear that they even have a problem in their brain and they collapse and they die, and sometimes it is only a child that the mother has. Why are you leaving the child to go far? Because you know that time to time they have a crisis, except those ones that have a higher level of fetal hemoglobin. So techniques such as CRISPR-Cas9 gene editing and lentiviral vector mediated correction aim to modify the genetic mutations. Of course, but how many patients in a low resource setting can handle the gene therapy or gene editing method? Next. Hello, I hope you are hearing me. Hello. I hope the audience are hearing me. So now the role of technology in sickle cell disease diagnosis. Accurate and early diagnosis of sickle cell disease is critical, is paramount to preventing complications and reducing mortality, especially in high burden regions, especially in Africa, India, and Mediterranean regions. Traditional diagnostic methods such as hemoglobin electrophoretic pattern and high performance liquid chromatography remains the gold standard, but are often costly, labor intensive, and inaccessible to low resource settings. So the advent of technology-driven diagnosis solutions, including point-of-care testing, whereby maybe on the bedside you just collect blood as a drop and then you get the result immediately. So that one may not even need professionals. It may not even need the help of well-trained medical lab scientists or even nurses. Every other person in the health system and even the parents will be able to do that, and they know the result, the outcome, of course, and they know the best approach of interacting with healthcare providers or healthcare workers. Artificial intelligence assisted imaging, of course, this will collect a lot of data and data relating to the patient, to the child, the patient, analyze it, and then we'll be able to even predict at a time that the child may have vaso-occlusive crisis, and of course that will be prevented, because in public health we talk much about a preventive stage, not a curative. It is better to prevent diseases in spreading in the society. And then a digital data management system, which has revolutionized sickle cell disease by making it faster, more accurate, and widely available. Next. So one of the most significant advancements in the sickle cell disease or early diagnosis is this point of care, which I've already explained. The artificial intelligence, which everywhere in every sector now is utilized, and I encourage all of you to key into it. Utilize it in your profession, utilize it even as a doctor. You need to use it with precision, with a personalized medicine. Now, the people in pharmacology or pharmacists, you produce drugs that are tailored towards the need of a patient, because of course you know about gene variations. Even if they are from the same parents, they will not respond to the treatment the same way. Of course, you tailor it towards the need of a particular child, knowing that genetic variations will also affect a response or improvement or prognosis of these children. The next. So additionally, genetic testing technologies have also advanced significantly, making a DNA-based diagnosis of sickle cell disease more accessible. Techniques such as polymerase chain reaction, next gene sequencing allow for precise identification of hemoglobin gene mutation, enabling a definitive sickle cell disease diagnosis and carrier screening. So another major breakthrough is the use of biosensors and then lab-on-a-chip device for sickle cell disease. So these microfluidic technologies require minimal blood samples, so it is less invasive. I say create less pain, because there are people you ask them to show their, let us collect your blood. It is invasive, it is painful, so and can rapidly assess the hemoglobin properties, providing efficient and cost-effective diagnostic alternatives. So digital health solutions such as electronic health records, as the other speaker mentioned, and then cloud-based diagnostic platforms also play a vital role in streamlining sickle cell disease diagnosis. So this system enables healthcare providers to store, assess, and shape patient data efficiently, facilitating a better coordination of care and long-term disease monitoring. And let me say this. There are a lot of hospitals you go, if you see the way they store their information about the patient, you know you cannot draw any clinical decision without the way they store it, whether in the computer, whether as in the file, in the maybe a manual, anyhow they are doing. But health information about the patient are very, very important in making decisions, of course, again, in predicting what happens in the society, even in 5 years or in 10 years coming. And then, of course, the donor agencies, the policymakers will use it to make a better policy to help the humanity, because public health is just to make sure that there is an increase in health, and that the population, the citizens, the people in the society, they live healthy, they enjoy the environment, and even the people, their own offspring, the people coming after them when they have left here, the place is also safe for them. The next. So telemedicine and digital health for patient management in sickle cell disease. So one of the most impactful applications of telemedicine in sickle cell disease is remote patient consultation, which enables individuals to connect with a hematologist and other specialists without the need for frequent hospital visits. Of course, to reduce a lot of stress, to reduce a lot of hazard on the road. Of course, if you go to maybe sub-Saharan Africa, developing countries, most countries may not have even accessible roads. A lot of places are vulnerable, people are vulnerable, a lot of crises are going on in the society. To reduce all those problems, you can connect to the hematologist, connect to the health experts, even electronically through where you are, because thank God these days network of internet has made the world a global village, whereby you can stay in your door, you can see what you are doing, you are in your place in different countries, in different continents, and all of us are interacting as if we're in the same conference hall, seeing ourselves, and it looks like a real life situation. Virtual consultation via video calls, phone calls, mobile applications allow for continuous medical supervision, reducing unnecessary emergency visits and hospitalization. Mobile health applications have significantly improved patient self-management and adherence to treatment regimens. So these apps allow patients to track their pain episodes, monitor medication intake, and receive automated reminders for hydration, medication, and follow-up appointments. So some advanced applications such as a smart app for sickle cell disease, integrated AI algorithms that analyze patient record symptoms and provide real-time feedback on patient management. Of course, these applications will help even the parents to track, to monitor the risk of or the triggers around their children. And of course, they will know days they may not leave for work. They need to stay around the children, monitor them to ensure they take their drugs, to ensure that they are hydrated, because dehydration also causes a great inflammation on them, and that will trigger even the vaso-occlusive crisis, which is a crisis state, and that will need attention in the hospital. And not just that, it also leads to anemia. And of course, remember, their hemoglobin level are perpetually low. Even of course, if you see that in a normal human being, they will not be able to be moving around, but because of compensatory mechanism from the bone marrow, they are also moving around. But of course, you have to maintain that their hemoglobin level at a steady level, of course, so that they will not be facing incessant crisis. The next. So wearable health technologies are another game changer in sickle cell management. Devices such as smart watches. Of course, these days you are lecturing, you are teaching students. Some of them, you see watches on them. You may not know that they have a wearable health technology, and of course, or some other things, dictating tools they use. As a biosensors are there, which can continuously monitor vital signs, including heart rate, oxygen saturation, and blood temperature. So these are the real-time data collection allows for early detection of potential complications such as a vaso-occlusive crisis or accurate Chase syndrome, enabling timely medical intervention. And of course, in this case, there will be reduced mortality and morbidity rate among the patients. And then AI and big data analytics play a crucial role in optimizing sickle cell disease management by predicting a disease exacerbation and tailoring treatment approaches. So AI-powered models analyze patient data from electronic health records, wearable devices, and self-reported symptoms to identify patterns in disease progression. And this will help the patient, help the parents, help all the health workers to know how to handle a particular patient. The next. So cloud-based electronic health record system enhance care coordination among healthcare providers by enabling seamless data sharing across different institutions. Of course, you remember the last speaker was talking about that, whereby even from one health worker to the other, you even approach hospital from the record unit, they get your, and then the people taking your vital signs. From there, they take the records straight to the next person, from the next person, so there's no need of carrying files here and there again. This is particularly beneficial for sickle cell disease patients who may require emergency care in different locations. So cloud-based platform ensures that physicians have instant access to patient medical history, test results, and treatment plans, reducing the risk of mismanagement and improving clinical decision making. So it makes the work faster. It makes the saving of the child to be even prompt. Instead of having casualties, instead of having on record a kind of preventable death, it will help to prevent the effect of what would have happened if there is a delay. Because in management of sickle cell disease, there is supposed not to be any delay. Any delay for them can lead to death. The next. So AI and big data in personalized sickle cell disease treatment. So one of the most significant contribution of AI in sickle cell disease treatment is ability to predict this vaso-occlusive crisis, which I told you is one of the major events that happen in them, and it's causing a major problem. So by analyzing a vast data set, including a patient medical histories, wearable devices, matrix, environmental factors such as temperature, humidity, and real-time physiological signals, the AI models can now forecast the likelihood of a patient crisis before it occurs. So because you're able to predict it, you now see that that child may not suffer that crisis. Of course, you will be taking a preventive, precautionary measures to prevent, to avert that danger that may strike that child. So big data analysis also plays a crucial role in personalized pain management strategy for sickle cell disease patients. Traditionally, pain episode in sickle cell disease are managed using opioids and non-steroidal anti-inflammatory drugs. The response to these treatments varies significantly among patients because of gene variations. The next. Hello, next. So another breakthrough for AI-driven sickle cell disease management is drug repurposing and optimization of treatment regimens. So the AI models can rapidly analyze thousands of existing data or drugs to identify those with potential benefit for sickle cell disease. For example, AI-based drug discovery platform has significantly identified new uses for hydroxyurea and other therapeutic agents, which of course this hydroxyurea will help to induce the secretion, the synthesis of hemoglobin F, which will help to confer protection for this child. So machine learning in genomic research is further enhancing our understanding of genetic variation that influence sickle cell disease severity and disease treatment responses. The integration of AI-driven clinical decision support system is also transforming a real-life time treatment decision in sickle cell disease care. The next. So advancement in gene therapy for sickle cell disease. So one of the most groundbreaking approaches in gene therapy is CRISPR-Cas9 based genome editing, which allows for precise modification of defective beta globulin gene, which, where I told you, is a single point mutation. So scientists are able to develop their strategies to either correct the mutation in the hemoglobin beta chain gene or reactivate fetal hemoglobin synthesis, which can now compensate for the defective hemoglobin S. So of course they would trace that gene where there is a kind of a disarrangement of amino acid order there, the codon there, and of course they will now correct it with a correct amino acid, and then the bone marrow started producing normal hemoglobin. And then lentiviral gene therapy is another major advancement in sickle cell disease treatment. This approach involves the use of genetically engineered viruses to introduce a functional copy of the beta globulin gene into hematopoietic stem cells. So one such therapy, lentiglobulin BB305, has demonstrated a remarkable success in clinical trials, with a patient achieving near normal hemoglobin level and then reduce sickle cell disease related complications. And of course, I mentioned CRISPR-9 before. Yes, next. So the challenges in gene therapy for sickle cell disease: one is the complexity and safety of gene editing procedure. You have to consider the complex nature of that, and of course it needs a professionalism. It's not everyone that can do it, and then of course the safety of it is also very important. Another one is a need for myeloablative conditioning. So before reinfusing of a genetically modified stem cell, patient must undergo myeloablative conditioning to eliminate existing bone marrow cells. This process involves chemotherapy, which can cause severe side effects. And of course, that will also make you to be very careful of the use of it. Another thing is a high cost and a limited accessibility. I keep on saying it, that is not something that poor people may afford. The government may be involved to help the patient, and of course, sometimes you see that these children may come from low-income parents, poor parents, and of course, they need the help of the community. They need the help of the society to even to afford some of these clinical healthcare. The next. Another thing is infrastructure and healthcare capacity limitations. Like the speaker that have traveled to some low resource countries, you will notice a lot of lack of infrastructure, lack of equipment to handle these patients. And ethical and social consideration. So gene therapy raises ethical considerations regarding its long-term consequences, especially with the genome editing approaches that induce a permanent change in DNA. And because of that, of course, ethical consideration must be considered. And long-term efficacy and durability. While initial clinical trials have shown promising results, long-term efficacy remains uncertain. So there is a research, the place is open for more research, for people to come into it and explore the long-term and longitudinal research to know the effect of these treatments on the patients. And then patient and public perception. How do patient and the public perceive this approach, misinformation, cultural beliefs, and skepticism towards gene therapy may hinder patients accepting these treatment options, because you need to convince them, you need to make them to know what the role, the benefits over the disadvantages before they will accept to go through gene therapy. The next. The recommendation for advancing gene therapy for sickle cell disease. You have one is advancing research on safety and efficacy so that the treatment will be very safe and they will be able to accept it, reducing the treatment costs and improving accessibility, strengthening the healthcare infrastructure in low resource setting. Next. And then ethical governance and policy development. Of course, ethical concern regarding gene therapy, particularly related to genetic modifications and potential disparities in access, must be addressed through global ethical guidelines and policy framework. Another one is expanding education and public engagement. And of course, I suggest to a lot of people on that are in leadership positions, policy making in the educational system, to incorporate sickle cell disease education to the even from second primary school, from the junior school to tertiary institutions, creating awareness, educating, empowering these children, and of course, when it is time for them to marry wisely, to ensure that they know their hemoglobin genotype early enough, and then marry with genotype that are compatible, that will not be able to lead them to produce sickle cell children. Personalized approaches and tailored therapies. Remember the gene variations in each human beings. As I told you, the way each person responds to treatment is not the way another person responds. Even if they are even identical twins, they are the only close people that may respond in a similar way, but not exactly the same way, because of course there must be some variations that are traceable to cellular or molecular level. The next. Fostering a global collaboration and partnership is very important. Just like this conference we are doing now, of course, we align with people that have a similar research interest. I call upon some persons to go into research, to collaborate internationally on the to find a cure, to find a better way of improving the life of sickle cell patients. And again, monitoring and post-treatment care. You have to monitor them while you administer the treatment, and of course, even after the treatment, you follow them up to see development and then prompt approach to take care of them. The next. In conclusion, gene therapy has emerged as a transformative approach in the treatment of sickle cell disease, offering the potential for a permanent cure, for directly addressing the genetic root cause of the disorder, and then advancing gene editing technologies like CRISPR-9, lentivirus vector-based therapies and base editing have shown promising results for early-stage clinical trials. To maximize the impact of gene therapy in sickle cell disease, it is essential to address the challenges raised. And of course, it's also important that we maximize the technological advancement these days. Of course, the AI these days, a lot of development in technology, in machines, even laboratory-based machines, molecular approaches to make for early detection and then for proper management of these sickle cell children. And I encourage the sickle cell children all over the world to know that there is still hope for them. Let them be happy. Let everybody join hands to help them to live a better and a well promising life. Thank you so much for listening to me. And I don't know whether you have any question. Thank you.
That's excellent. That's really superb. And it's a very interesting presentation, Professor. We could understand a lot about the sickle cell anemia, and that's really great that you are here today and you presented your speech here. I guess the speakers who are there in the panel, they might be very happy with the speech, and they might have got very good information about sickle cell anemia disease. That's great. Thanks a lot. If there are any questions, definitely we are going to send you the mail, and please revert back for that. And guys, please a huge round of applause for his presentation.